it live?
Yes.
How many people do you have now? Not too much of it. Not too much. Hi everyone. So we'll wait until we have about 10 people or 20 and then we can now begin. So in the meantime, stay put on so we can have more people join us. So hope everyone's doing okay. We now have about 5 people. We'll just wait for about 5 more and then we'll start properly. So in the meantime, just stay on. You can be posting questions, any question that you have in regards to kidney health or dialysis or all matters that concern kidney health today. So post them up and then we'll be answering them as we go along. You'll also find that as you present, you find answers in the presentation. So just type them in. Make sure you comment on the comment line right there below, and then we'll come back to each and every question. So let's make sure this is very engaging. I want us to have a very engaging conversation today. So it's not more of a presentation, it's an interaction. So make sure you're commenting, ask your questions, we answer them as we go along. Is it type C? Is it type C? Oh, hi, Buka. Thank you for that one. So let me try and work on the volume so that everyone can hear me. Because I think we need to increase the volume. So I don't know if you can hear me now, so we'll try and test it out. Some test to see whether we can be heard properly. Someone confirm that they can hear me properly, better than I was sounding before. I think it's better now. Yeah. I'm still not audible. My volume bad. I'm struggling with audibility. Okay, now we have more than 10 people, so we're going to begin soon. So watch out, we work on the sounding. Now, I don't know if you guys can hear me now, or I need to be more loud. So someone confirm that they can hear me well, and then we will start. Better. All right. Okay, so now that we have 10 people as we promised, we need to begin. I welcome you all. Today marks World Kidney Day. So this is the day that we usually talk about kidney health, how to prevent and manage kidney failure, seeing that it's almost becoming a very common thing now, and it's affected by very many factors. So while we are talking about that, I'd like to introduce myself. My name is Bianca Wamboi Kunita. I'm a certified clinical nutritionist here at Bristol Park Hospital in Nairobi. So Bristol Park Hospital, as you know, is an inpatient and outpatient healthcare center that is located in Fedha. Here Nairobi is located in Fedha, Tasia, and Utawala. And we also have branches right across the country. We have one in Machakos and another one in Kitengela. So now that you're all acquainted with the hospital, first of all, karibuni sana to our life. So I'd like to remind you all that, again, being World Kidney Day, while we are teaching you and letting you know about kidney health and how to manage the same, we'd also like to invite you to come for free screening. We'll be screening you for just your BMI, your weight, your height, your body fat percentage. We have partnered with About Nutrition, who are also here to be able to assess your health and just to know whether your electrolytes are okay. So make sure to come by. We also have reduced prices for some of the various tests that we use to be able to screen and to assess kidney failure. So don't consider to come in and get that done today. So while we're here, let's begin. So we need to first understand what kidneys are or what they do, so that we may know what kidney failure is and why it's very important for you to take care of your kidneys. So your kidneys are just basically organs that are located somewhere at the back here or here in your body, and kazi yake is just to basically filter waste from your body. They also help to form some red blood cells. They also participate in that purpose, and then they just keep you and your blood just clean in general. Yeah, so those are the most basic functions. That they also participate a little in your bone health. So that's why, so you can see that they usually take part in very, very major functions of your body. So it's important for you to learn that. So while we're doing that, when your kidneys are healthy, you'll find that you are able to prevent fluid overload in your body. Your red blood cells are working well, so that means your oxygen is being carried properly in your blood. And then you also have very, very good bone health, amongst the few things that we are going to mention. So when your kidneys are not okay, what are some of the things that you should look out for? So we are going to talk about some of the early signs of kidney failure. One of them, very importantly, like I said, is fluid overload. So you find that your ankles are going to be swollen, your face is also quite puffy, and especially around your eyes. Your skin usually also suddenly becomes quite dark, very, very dry, very itchy also. You might also find that you feel very nauseated. Sometimes you even vomit. Sometimes you might even find, like, over a long period of time, your bones will also start to ache. Your knees hurt, your muscles are also achy and things like that. You're constantly tired. You're having a hard time concentrating also. So those are some of the things you need to look out for, yeah? So another very common one is just, like I said, the swelling of the ankles and the puffiness around your face. Usually, almost certainly, the first sign that you need to look out for. So if you have any of these symptoms, you need to come to the hospital for screening, yeah, to be able to determine whether your kidneys are okay. So what are some of the risk factors that we need to take care of? So what are some of the things that predispose us to kidney failure or kidney dysfunction? One very common one is if you have chronic conditions. Chronic lifestyle conditions like diabetes, high blood pressure, and of course the ones that are not managed well. If you have chronic diabetes or hypertension that is not well controlled, you stand at risk for kidney failure. So those are some of the things that you need to take care of. Another one is any kind of heart disease, and hypertension is one of them. They predispose you to kidney failure. Another one is lifestyle factors. Lifestyle factors like smoking, if you drink alcohol excessively, if you are constantly dehydrated, you do not drink your water often, you go days without drinking your water, that can also expose you to kidney failure, yeah? And then if you do not exercise, again, exercise plays a very important role in managing your weight. Obesity and overweightness usually predispose you to kidney failure. So kukua mnono ama kukua na kitambi si utajiri, ni ugonjwa. So that is something you need to note, yes? So if you are obese, if you're overweight, and then you have some of the symptoms that I talked about before, that's something to also look out for and just come for screening, okay? So while we're continuing, some of the dietary factors, some of the things that you're also consuming can also predispose you to kidney failure, yeah? One of them very commonly is if you have a very salty tooth. Watu wako na sweet tooth, lakini kuna wale ambao pia wanapenda chumvi. So if you're consuming too much salt, and too much salt from, say, things like processed foods, like some of these baked goods, the snacks we're having, that are very salty, and you're having them constantly every single day, and your diet is also very high in fat, very high sugar. For example, you're drinking so much of the energy drinks, you're drinking too much soda every single day, you're not drinking your water is semi-qua soda. That also puts you at risk of kidney failure. So that's also something to look out for, okay? Another one is if you, for example, are on medication. Some of the medicines that we consume also predispose us to kidney failure, especially painkillers. I'll call them that. We call them NSAIDs. Some of them, if you are taking them for way too long, for years, you are chronically managing pain with NSAIDs, you might also find that your kidneys may begin to fail because of the same. So that's also something to look out for. If you are, say, maybe you have arthritis and you're constantly taking pain medication, I think it's important for you to consult your physician to find alternative methods or more natural methods for that pain management, or any other form of condition really that is, say, it involves a lot of pain and you need to be on chronic use of NSAIDs. Consult your physician, find an alternative for that, okay? Another one is just basically if you also abuse drugs, not just drugs, the pain meds, but also just any other type of drugs. Remember we said that your kidneys play a major function in getting rid of toxins in your blood. So if constantly you're taking, you're abusing drugs of any kind, hard drugs also, you'll find that your kidneys may begin to fail. So that's also something to look out for. Another one is if you are exposed to heavy metals like lead. And this one usually is for people who work in the industrial area, who are constantly exposed to, things like lead and other hard metals. That's also something to look out for. I know there are measures to be able to protect you from the same, so make sure you're always in your PPEs, for example, for your industrial work, okay? So that you may protect your kidneys also at the same time, alright? So we've talked about some of the early signs. I will repeat them again. If you're swollen, you have constantly swollen ankles, and your face is also puffy, you're nauseated, you're tired all the time, you barely concentrate. Those are some of the things that you need to take care of to be able to be screened for kidney failure. Sawa sawa. So now that we have learned some of the risk factors, what signs to look out for, and what role your kidneys play in your body, and you see that you have some of these signs and you need to look to know what really is being assessed when you come to the hospital. There are three main common tests that we usually do. One very common one is called UECs, urea electrolytes creatinine. We usually assess this test. It's a blood test that's taken to be able to assess whether your kidneys are functioning well. If any one of the electrolytes are very high or very low, it may be an indication of kidney failure, yeah? And then especially the creatinine and the urea, because those are the main electrolytes or the main substances or compounds that usually your kidney works to get rid of. So if the levels are too high, then that usually categorizes different stages of kidney failure. If it's slightly elevated, we say you have kidney failure. If it's very, very high, if the creatinine and the urea levels are too high, then we may categorize that as chronic kidney failure. For you to get to a level where now your kidneys are not filtering any urea or any creatinine from your blood, then we may say that your kidneys have not been working for a very long time. So those are some of the things that we look out for, okay? So I hope we're together till there. Another one is the way or the level which your kidneys usually filter this waste. We have a measurement, a calculation that we do to be able to determine that. We call it EGFR, okay? For short, it's just estimated glomerular filtration rate. So again, if these levels are too low, yeah, if they're too low, then we can say that your kidneys are not able to filter waste well. Another one is just basically a ratio between your albumin and your creatinine. Albumin is a form of protein in your blood, okay? So if that ratio again is it's unbalanced, then we may say that your kidneys are failing. So those are some of the main common tests that we usually do to assess kidney failure, all right? So now that we have learned all these things, what do you do to be able to prevent this condition in the first place? We have said one, usually early assessment, early screening is one of the best methods to be able to prevent you from having chronic kidney failure. So once you're able to screen early, the moment umepata kasign tu kadogo ama kamoja, go to your hospital, immediately get yourself screened. Do not wait until your kidneys have failed completely. We need to remind you that once your kidneys have failed completely, it's irreversible. It does not come back. Then you need to have like a chronic treatment to be able to help your kidneys function well. And we'll talk about that later when we're talking about some of the treatment methods that we use to manage kidney failure. All right? So early screening is number one. Number two, you need to be able to look at the risk factors that we talked about and manage those factors. Like for example, if you are on constant use of, say, drugs, or NSAIDs, pain medication that you're taking every single day, you need to assess that. Yes, you said you find alternatives. I'll give you a tip. The use of something as natural as turmeric essential oil or turmeric in itself, every day in your food or as a tea is a fantastic pain relief medication that is safe for your kidneys, safe for your liver. So kama for example uko na arthritis imekusumbua sana miaka mingi, anza kutafuta na kupenda turmeric tea, alright? And that will help you so much to be able to relieve yourself of that pain. So again, if you're abusing drugs, hard drugs, and it's an addiction, then you need to take care of that addiction, alright? If you are abusing them for, say, for leisure purposes, then you need to reconsider that, and so that you may be able to protect your kidneys and your health in general. Not just your kidneys, but also other organs are affected by chronic drug use, alright? Another one is if you do not drink water, you need to set up, I don't know if you use a timetable or a timer to remind you to hydrate. Very regular use of just water or consuming water really helps to protect your kidneys and just keep them healthy and safe. So that's something you also need to consider. Hydrate na maji, stay hydrated, alright? Another one is exercise regularly. Remember we said that a healthy weight equals healthy kidneys, equals healthy heart, equals healthy other organs, alright? Obesity-related kidney failure is also something that is on the rise, so that's something you need to look out for. Kunaona tumesema si utajiri, si ndio? Tumesema ni kukosa afya, alright? Another one is to smoke. If you are smoking, you need to reconsider that also. The cessation of smoking also helps to really keep you off high blood pressure issues. We talked about high blood pressure being one of the conditions that brings on kidney failure. So if you're smoking constantly, that's also something to look out for. Pressure is not the only thing you need to worry about. Your kidneys also may fail also as a result. So that's something to look out for, okay? And then ingine, just manage your blood pressure. If you are hypertensive, then you need to be on medication or lifestyle changes to manage your blood pressure. Hizo dawa umeandikiwa sio at lifelong, ni chronic tu za kukusaidia kuweza kumanage pressure yako and to be able to protect your kidneys from failing at any point. So that's something you need to reconsider. Sometimes if you have been taking pressure medication and your pressure is not being managed well, consult your physician, usikae tu nyumbani, and don't stop also taking your medication to lower your blood pressure, alright? So sometimes when we give you medicine, we're not giving you medicine so that you can continue to take them. We need to protect you from some of the complications of unmanaged blood pressure, unmanaged diabetes, which is in form of, then again, kidney failure or even your heart failure, yeah? So those are some of the things you need to reconsider, sana. Stay on your medication, have them reviewed monthly or 3 monthly, sawa? And then the other one that you also need to really take care of in terms of diet is if you are consuming so much salt in your food or in your, say for example, you're also taking a lot of processed foods and snacks, you need to stop that, alright? At the end of the day, it will only give you a short-term relief, short-term happiness, but at the end of the day, chronically, inathuru kidneys zako. So that is something to look out for, alright? So if you're taking crisps, salted snacks, avoid them, alright? That's another very simple place. Hiyo ni mahali rahisi sana over-consume chumvi. So wachana na processed foods. Hata soda, energy drinks also. Things like Red Bull, even Monster, even the ones that you think are harmless. they are harmful at the end of the day. So you better reconsider that. Another one is to, again, in place of water, you need to stay hydrated, and we've talked about that. Another one is to try and eat kidney-friendly foods. Foods that help to maintain and improve your kidney health. Like, for example, berries. Some of these fruits you take. Thorn melon hii yenye unaona thorn melon ya watu wa diabetes. Thorn melon si ya watu wa diabetes peke yake, ama watu wa pressure. Even you, with your healthy self, you can consume thorn melon. Some of these fruits have very good antioxidants that help to get rid of these toxins and to just generally improve your health, not just your kidneys. So that's something to look out for. Eat your fish, eat healthy fats from fish, from nuts, from your avocado. Things like that help to keep your kidneys healthy and also your heart healthy at the end of the day. Consume your greens. Mboga sio za sungura peke yake, hapana. Mboga pia wewe unakula. Mboga sio za wajawazito, hapana. Pia wewe kula hizo mboga. It's very, very important to consume your greens every single day. Alright? Do a variety. If you don't like spinach, find an alternative for spinach. If you don't eat sukuma wiki, eat spinach. You know? Try and incorporate greens as much as possible in your diet. Sawa. Another one is if you're over consuming protein. Say maybe, for example, if you're eating meat every single day and red meat and in very high quantities, eating meat is good for you. But if you're over consuming meat, is also a problem. Especially kama kila siku wewe uko kwa choma base, hapana. That is bad. Find a variety. Sometimes it involves also eating your grains here and there. Try eating your beans, your cereals, you know, as long as your kidneys are okay and they allow you to consume them. Eat your meat, find a variety. Eat fish today, tomorrow it's chicken, the other day it's eggs, then now eat your red meat, like that. Don't overconsume one food. Yes, we said too much of something is harmful, alright? So that's something to also consider and remember. Also, we just said you maintain a healthy weight. Weight loss may help to also reverse your hypertension or your diabetes at the same time. So that's also something to consider. Alright? So once we have talked about all these lifestyle and dietary methods that you can help to prevent chronic kidney failure, we also have to remember that there are people who also are living every day with chronic kidney failure. So what do? There's a special diet that we usually adjust according to the UEC's test that we do to be able to balance out some of these very specific electrolytes. Very commonly is phosphorus and potassium. Those are some of the things, and sodium. Those are some of the things that your kidney is not now working well to be able to get rid of. The very most common method to manage chronic kidney failure is dialysis, and dialysis comes in two types. Alright, there's the hemodialysis, and then there's another one that's called peritoneal. Hemodialysis is the one that is very, very common, alright? And we do it right here in our institution in Feather branch. So when you now are constantly doing dialysis, you also need to check your diet, yes? Dialysis peke yake si haiwezi manage chronic kidney failure. You also need to take care of your diet so that you do not overload these specific nutrients. So for you to be able to adjust them, you also need to remember to consult your physician and your nutritionist, so that they also adjust how your diet and your medication also looks like. So those are some of the things that are very important for you to remember. Another very uncommon method that we usually do also to help reverse chronic kidney failure, and I had said chronic kidney failure is irreversible, but it can be reversed with transplants, like kidney transplant treatments that are not very common and they are also quite expensive. So instead of getting there, what you can do is to try and protect your kidneys so that they may be able to serve you for a long period of time. So those are some of the things you need to look out for. If you are 60 years and above, in fact I'll say if you're 50 and above, and you have never done your UEC test, this is the time to now do it. Sometimes it's not always about lifestyle. Age is also a risk factor for kidney failure. So if you're 60 and above, remember to go constantly to the hospital to get yourself screened and learn methods to also keep you healthy. Alright? So I'll keep my presentation short So I'd like us to now interact and ask those questions, any question that you may have regarding kidney health. So we'll be able to answer them as we go along. All right? So let's see the questions that we have here today. So let's see them. Again, if you have a question, just ask down here. You can type hapo chini. We'll be able to answer them, okay? So we'll start from the very first one. Guka here said, Daktari, hi. Hello, Guka. I hope uko salama. And I hope tumeland vitu mingi sana leo. Someone here said, good morning. Good morning, right back to you. Someone is asking about CPD points. This is just a general live session, so we will start considering to have more sessions and more interactions that will provide you with CPD points. Yes, I know they are very important for you to renew your licenses, but unfortunately this particular one is a community awareness live. So yes, so we'll be on the lookout for other more professional lives to do in the future. Okay. Someone here suggested we should do a TikTok live next time. Thank you for that input. So it's been noted. So maybe perhaps in our future lives we'll consider doing TikTok, right? I think it would also work well for us to be on TikTok. Yeah. All right. Again, if you have any more questions, don't hesitate, please ask them. So we'll give us a bit of time, probably give us about like 20 minutes to wait for your questions. And then we'll call this a very beautiful day and then allow you to come to Bristol Park Feather to have you screened for kidney failure. Sawa? Alright. Okay, we keep the questions coming. I'm glad at least the sound was better, so I hope we all learned a lot today. Alright, we also need to remind you, you may want to also come today for, for further counseling, or you've been, getting your treatments and you'd like not join us to see your physician or to see your nutritionist. Remember that we also have a link linked to this particular video, and you can be able to attend our live, and you can be able to book your appointment right from that link below. So don't hesitate. Just click that link, it will direct you to a place where now you can book your appointment. Alright? Sawa sawa. Okay, so if we have no further questions, thank you so much for interacting with us. Remember, today we mentioned is World Kidney Day when we started, and this is why this live is here today, to be able to remind you why your kidneys are actually important and not to be ignored, and what role they play, what some of the risk factors are for kidney failure, and then how to manage and prevent kidney failure in the first place. So thank you so much for coming to our live today. I'll remind you again, there's a link that is linked to this video, to this live, that you can book your appointment from. Don't hesitate, click your link, it will direct to our front office where you can book your appointment. Alright? I'll remind you that this is a 24-hour hospital service, so you can come in at any time to be able to be seen by your doctor. However, if you'd like to see a specialist like a physician or a nutritionist or any other specialist regarding the management of any condition that you may have, that is done during the daytime. Alright, but for anything else you can come in. We'll be doing free screening today, like I started saying. There's free screening today for your weight, yes, your BMI. I said that we partnered with About Nutrition to be able to assess your body composition and to just tell you whether you're obese and at which stage you're obese, and whether your electrolytes are actually okay even. If you'd like to know what your body fat percentage is, today is the day to do that. Alright? So karibuni sana. We also would like to tell you that for these tests that I had mentioned, to be able to screen your kidneys, are also at a reduced price just for today. So hesitate to kuje, you do your urinalysis, and your urinalysis is now 350, and then the other test that is now your UECs now cost 1700 as opposed to what was costing before. So hesitate, just come, we'll get those tests done. Your blood sugar also screening can be done today at 300 bob. Blood pressure will also do it for you for free. Alright? So karibuni sana, hesitate kukuja. We're looking forward to seeing you today. Alright, and thank you so much for engaging with us. We're looking forward to seeing you on another live soon. So as you know, I was your host, Bianca Kunyita, and the nutritionist. Karibuni sana, Bristol Park. Okay. I'd also like to remind you, Feather is not the only branch that does dialysis. We do it here in Feather branch, and we also have Machakos, Bristol Park that also does dialysis. So kama hauko Nairobi, but uko Masaku, you can still get your dialysis done at a very affordable rate also at the same time. We also have to mention that it's also SHA approved. So if you have SHA and you would like this to choose Bristol Park as a place, as your preferred hospital for dialysis treatment, it can be done. Alright, so hesitate, enda at Bristol Park Machakos, I'm a Bristol Park Hospital Feather to get your dialysis done. So yes. Alright, so karibuni sana, looking forward to seeing you later in the day. Bye bye.